So it says the Kenya Population and Development Conference Communique, theme, Navigating the Future, Population Dynamics and Sustainable Developments in Kenya. We means all of us, isn't it? The delegates drawn from the government, the academia, the development partners, civil society, religious institutions, and the private sector attending the first Kenya Population and Development Conference held at the University of Nairobi, Chandaria Auditorium, from 11 to 13 March 2025, make a statement as follows. We welcome the collaborations between the government and the population and development stakeholders in organizing the first KPDC conference, providing a platform for meaningful dialogue and deliberation on key population and development issues for sustainable development. Is that okay? That statement okay? Yes. We recognize that population issues are key in shaping development matters in the country and the critical need to have concerted effort to provide solutions. Is that fine? That we recognize. That we recognize also the theme Navigating the Future, Population Dynamics and Sustainable Development in Kenya as a timely and a critical focus in addressing Kenya's evolving population landscape and their impact on sustainable development. We appreciate the government of Kenya's commitments in planning for the future through integration of population issues into development as a key driver for achieving national development aspirations. Is that fine? We acknowledge the role of the government, development partners, CSOs, CBOs, FBOs, religious leaders, private sector, and other key players in the implementation of the population policy and the programs. We also recognize the success made in the implementation of the population policy and programs, despite continuing and emerging population and development challenges, which require critical policy and programmatic interventions. We note that sustaining the population program requires multi-sectoral collaborations. We recognize that quality data is needed to establish evidence base for determining the status of progress on the National Vision 2030, the SDGs, ICPD 25 commitment on the population development, and Africa we want of 2063. We reaffirm our commitment to supporting and implementing the population policy and programs to accelerate the achievement of population and development goals, including the Kenya Vision 2030, and hereby make the following resolutions. 1, human capital development and youth bulge. Accelerate investment in human capital, prioritize quality education, skills development, and workforce readiness for the national growth. That was our first thematic area. Tackle youth unemployment, encourage collaborations among all stakeholders to create jobs opportunities for the youth, leverage the youth workforce, harness the Kenyan young population to drive economic development, strengthen the public-private partnership, align skills training with the global market demands and job creation. We also reaffirm human capital development and youth bulge, utilize urbanization innovations, support youth-led innovations and entrepreneurship for economic growth, adapt to evolving job markets, embrace online work, digital skills, and emerging technologies to maximize opportunities, establish workforce mentorship, implement the mentorship programs to guide and empower the young professionals. Still on human capital, we are saying we need to reaffirm our commitments to digital information hubs offer promising solutions for youth employment, but challenges in funding and policy support hinder their full potential. Targeted solutions in education, WASH, and sustainability for ASAL counties due to high school rates dropout driven by climate change, poverty, and insecurity. Prepare for aging population by developing policies for long-term care to improve the quality of life, particularly for vulnerable groups, women, and the poor. On population health and well-being, this is what we reaffirm, and this is what came out of the conference. We need to strengthen the health system and surveillance for emerging diseases pattern. Health facilities to be responsive to the client need, ensure integration of essential health services to ensure people living with disabilities, older persons, ASAs, and other vulnerable population receive holistic and effective care. Implement free healthcare services for persons aged 60s and above. Utilize social media responsibly for health promotions. NCDs, that is non-communicable diseases, remain significant public health issue in Kenya with increasing prevalence and associated socioeconomic and health burden. Awareness and regular screening of NCDs are critical for earlier diagnosis to improve survival rate. Improve access to affordable screening and diagnostic services for non-communicable diseases, particularly in rural and low-income areas. Still on population health and well-being, integrate NCDs management into the strategies for optimal care, build capacity of healthcare providers and community health volunteers in managing non-communicable diseases. We need to invest in mental health, provide comprehensive care that integrates mental health and harm reductions. And again, on population policy and program, policies are tools for accountability nationally, regionally, and globally. So population policies are tools for accountability nationally, regionally, and globally. Government leadership and public participations are crucial in policy formulation to ensure legitimacy and legal alignment of these policies. Periodic assessment of the impact of implementation of population policy and programs also very essential. Leverage on data and research in implementation of the population policy. On population policy and program, there is need to management of diverse interests is key in coordination of population policies, and you have seen from the presentations. Program must be aligned to existing national and international policies and legal frameworks. Policy must be resonate with what's happening on the ground. On the population policy and program, we need to strengthen the multi-sectoral coordination and implementation of the sessional paper number 1 of 2023 on the Kenya National Population Policy for sustainable development that cuts across all sectors. Promote male inclusion and active engagement in population program to implementation to dispel misconceptions that population matters are solely a woman concern. Public-private partnership in addressing changing population dynamics is also very important. On issues of fertility and sexual reproductive health, I'm going through the thematic areas. There are more than many, very many. There are around 9. On fertility and SRH, we're saying strengthening family planning initiatives on the national agenda, that we need to prioritize FP as a national agenda. We need to promote the LMIS, that is LMIS for FP commodity security, use data to determine availability of commodities. This is last mile monitoring of the FP commodities. FP as a family planning is a collective and a faith-led obligation. Train religious leaders to be change agents for family planning, reproductive health, and male involvement. Adopt client-centered approach in family services provision. Integration of family planning in the medical services and medical insurance is also very important. Advocate for sustainable domestic financing for family planning, reproductive health. Leverage on the local radio stations and community-based outreaches to disseminate accurate family planning information. On population data, collaboration between data producers and policymakers is crucial for data-driven decision-making, requiring capacity building and data sharing agreements. Ethical data collection must ensure confidential, informed consent and protection of vulnerable population to enhance sustainable development. Accurate population data is vital for national development, but faces challenges in capturing informal settlements, nomadic groups, and refugees, requiring better methodologies and frequent updates. On still population data, technological innovations such as digital data collection, geographical information system, GIS, AI-driven and analytical improving accuracy and efficiency is also important. Civil registration and vital statistics, CRVS, play a crucial role in tracking population changes, but integration with national database remain a challenge. We have seen we have a lot of administrative data, but those administrative data are disjoint and not interconnected, because we need to have a platform to have this data harmonized. Data gaps persist for underrepresented groups, youth, elderly persons with disabilities, migrants necessitating specialized survey. On mobility, migration, and urbanization, we need to fully implement the national migration policy. Will be adopted on 17th March. Implement intelligent transport system and unmotorized infrastructure in major towns to aid in mobility. Development of policy on labor migration for protection of labor migrants, i.e. reduction of the cost of remittance, financial literacy on migrants, and addressing gaps in foreign labor markets is again very important. I think the reduction of the cost, I think that is, I think we need to correct that part. Then the part of migration, again, mobility, migration, and urbanization, development and mainstreaming of policies on return and reintegration of migrants was also discussed. Development and implementation of the laws on physical and urban planning to control urbanization, particularly in the peri-urban areas, housing programs to move away from Eurocentric planning to holistic planning, where houses in informal and peri-urban areas are also planned. This was a discussion that was happening yesterday, that the planning we have was a segregation plan, where Africans were planned to live in slums and the others were planned to live in. And they are saying we need to move away from that kind of mindset. Mobility and migration and urbanization, implementation of the 2023 Nairobi Metropolitan Spatial Plan to improve mobility through implementation of the bus rapid transport system. Population demographic are highly impacting on the mobility planning and settlement of the population in many areas, in many urban areas, including the youth bulge issues. Infrastructure like roads has great influence and effect on population distribution and settlement. That's a key socio-economic sector to economic development. On climate change, we say targeted, meaningful engagement of youth in climate change, policy decision-making and programming and intervention is also very crucial. Natural resources should be paid for. County government which draws natural resources from other counties should be made to pay to the other countries. That was what was suggested in one of the panel discussions, because there was some conflict in terms of resource sharing. Indigenous knowledge should be formed part of science that informs weather predictions. With precision in weather predictions, actors need to be deliberate in planning and preparedness for impending hazards. Climate info knowledge dissemination should be targeted and prioritized. Invest in green economy for job creation, climate financing, and seek global opportunities for climate financing. Climate change is a disruption that affects human sexuality, increased maternal and child deaths, SGPV, including female genital mutilation, child marriage, adolescent pregnancy, calling for urgent intervention. Climate change actions need to be prioritized and fast-tracked to reduce inequality while working towards the realization of both national and international development commitments. Colleagues, changing family structure. This was one of the last and very heated debate on the changing family structure. And this is one of the population issues that we have identified as a council. Promote pre-marriage preparation and counseling. Prospective couples should undergo marriage counseling and training. Strengthen family stability. Couples should prioritize resilience and conflict resolutions over divorce. Religious teaching should be harnessed to reinforce family values. Government and stakeholders should support policies that promote family well-being. Ensure children's well-being should be central to the family decisions. The changing family structure, parents must actively engage in their children's life to foster stability. On gender issues, there is a comprehensive legal framework on GPV and women's empowerment. Gaps remain in implementation. There is need for increased advocacy to ensure the effective enforcement of existing laws and policies. Male involvement is crucial in addressing gender issues. Interventions of effort should be focused on community and sensitization to promote active male participation in gender equality initiatives. Mentorship and capacity building for women, particularly in governance and economic empowerment, are essential. This effort should begin at an early stage in life to foster long-term impact. Technology-facilitated gender-based violence, which is an emerging concern that necessitated policy review to ensure adequate legal and institutional response. Need to explore the cause, I'm almost finishing, need to explore the root causes of intimate partners violence and gender-based violence. The current interventions measures are largely reactive, therefore a shift toward more preventive approaches is necessary to effectively address these issues. On financing, I think this one you all participated, promote efficiency in utilization of available resources, prioritization of population program and financial allocation, ensure accountability for resources allocated for population program. And lastly there, financing, you can see the dots there. We, the delegates of this Kenya Population Development Conference, declare our clarion call and commit ourselves to take the following actions. 1, can we do that? Advocate and support the issue of population and development across all sectors. Make full efforts to shape the future agenda for population and development by implementation of population policy and programs. Accelerate meaningful youthful engagement in all decisions that affect their health and well-being so that they may achieve their full human capital. Emphasize addressing demographic diversity to drive economic growth and achieve sustainable development. and develop inclusive policies that are evidence-based, holistic, people-centered, and responsive to ensure that no one is left behind. Commit to monitor and evaluate implementation of population program to track progress. Intensify efforts to fulfill the ICPD 25 Nairobi Summit commitments by actively reviewing progress and taking concrete actions. Advocate for increased and sustainable domestic financing. And lastly, strengthen efforts to achieve ICPD Nairobi Summit commitments by 2030, focusing on reducing unintended pregnancy, lowering maternal mortality, and preventing GPV. Support establishment of Center of Excellence on Population and Development to promote research, harnessing innovations, and technology, capacity building, and knowledge sharing. We officially endorse this communique for those, how do they say? Is it the I and the nay, isn't it? How many have endorsed this communique? Please raise your hand. The I have it, isn't it? This is a true reflection of our discussion. Is that right? Yes. So this communique I'm sure it's not, there's some editing issues. We will finalize and submit to you, share with you, so that at least you can also have your input.